That brings us to your weekly capsule of health information. We like to call it Your Healthy Dose, as we bring you the latest on what's happening. It's brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. We're going to be talking about spine, because the spine, well, there's so many things connected to the spine, and we can go into the song, but we're not going to get into that right now. But we're going to be talking about Spine Center, and Amanda Wassman joins us. She's with the Hannibal Regional Healthcare System, here to answer some Spine Center questions. Amanda, good to see you.
Good morning.
Good morning. Thanks for joining us. So, what is the Hannibal Regional Spine Center?
The Hannibal Regional Spine Center is a relatively new service that we're offering. It began in June, and what it is a collaborative effort to get patients in the door and to get them guided to where they need to go to get the best care for their spine or their back issues. So we know that around 50 million Americans are affected every year with back pain. The problem is, for a lot of people, is they don't know where to start or where to go. Do I go see a chiropractor, or do I go see a pain doctor, or do I go see my regular family practice doctor, or do I go straight to the spine surgeon, or do I just stretch more, or do I do some water aerobics, or do I rest? They don't know what to do. So what we've started is the Spine Center. So patients can come in and they're evaluated, and then they're led on a path of whether you need injections or whether you are a candidate for spine surgery. There are some steps you need to follow before you just jump in kind of the deep end and make that decision.
Because you don't want to do anything radical, at the first go.
Correct.
You want to take the first steps to see what it would take to really take care of the pain that's most effective.
Right. And as far as primary care physicians go, we know that that's one of the top reasons patients see their doctor is because of back pain. This will help them kind of cut out the steps. Patients would get frustrated a lot for going straight to say, for instance, a spine doctor, and them saying, you're not necessarily a candidate for spine surgery. You need to try this, this, and this first.
Sure.
So this would kind of help the patient get on the path they need to get to from the very beginning. And before you go and see a spine surgeon or see a pain management physician, there is this test, and this test that you need to do before you get there. So then when you do show up at that physician's office, you don't need to then have go away and have these tests done and then come back and then we'll talk about your pain. You already have all of that information with you when you get to your first appointment.
So it's making the taking that right step in the right direction.
Correct.
Instead of being spun around and then being dizzy, it's like not knowing what to do next.
Right. And when your back hurts, as we all know, you just want relief right now.
Yeah,
right now.
Yesterday.
Absolutely.
That's good to know.
Amanda, Rich says about taking the right step, and the right step first is to prevent that back pain.
Correct. Right? And a lot of things are very cut and dry. Just get up and move. A lot of times when your back hurts, you don't want to do that, but it's really what's going to help your back get strong, stay strong, and prevent a lot of the injury in the first place. Making sure you get regular checkups, because they can catch something early on. Maybe that's starting. If you have some disc degeneration that's beginning, maybe they can catch that before it gets too bad. If you're overweight, obviously losing weight, not necessarily just for your back, but for a multitude of health reasons. Practicing good posture, and then resting easily and properly. A lot of people ask, they hear of all of these different types of mattresses and which mattress is better than the other mattress, and that. I have spent a lot of time with Dr. Raul Basho, who is the medical director at the Spine Center, and I've heard him talk to community groups, and he has said, get whatever mattress you can rest on. So that's his
whatever you can rest on that feels good,
is comfortable for you, and that you are getting at least 8 hours of rest on per evening. That's what works for you.
Okay.
So obviously cardiovascular exercise, like I mentioned, and then if you're a smoker, try to stop smoking, again, for a multitude of health reasons, and then using back smarts, lifting techniques, and if it says it's a two-man job, don't try to lift that on your own. And then a big one for a lot of people is avoiding hours at the desk. If you're working at your desk for most of the day, get up and walk around a couple, 2-3 times a day, just to stretch out. If you can stand at your desk for a little while and do some of your activities there as well.
Okay.
A lot of it is staying active.
Right.
Yes.
But if you have the problems, what types of conditions are treated through the Spine Center?
Well, obviously, if you have an injury to your back, say you have an accident or something, you're not going to want to wait and see the spine center. You're going to want to go to the ER. That's something that we would bypass the spine center for. But if you have arthritis in your back, that's something we can see. Just general back pain that you've had for a while, but you're ready to get some relief. Disc degeneration, herniated discs that you've already been diagnosed with. Spinal fractures that you have, any type of spinal deformity or spinal tumors. If you've had a failed spinal surgery, if you've had surgery in the past that didn't work or didn't whatever, Dr. Basho can take a look at that and see if there's anything he can do to relieve that pain or to correct that. Mm-hmm. Scoliosis or spinal stenosis, which is the narrowing of the around the nerves in the back that would cause radiating pain down the legs or into the arms and that kind of thing.
Yeah. It's it's a very tender area, and one thing can lead to the other, and it's always best to leave it to somebody who knows what he or she is doing that can properly give a diagnosis and properly treat it. Mm-hmm. You've got a special seminar that's coming up that deals with just all this.
It is. On July 8th, we're having a free seminar for the public. It's called Caring for and Protecting the Spine. It's hosted at Hannibal Regional Medical Group in our first floor conference room. And like I said, it's free. We will be providing lunch, and it's from 11 to 12, 11 a.m. to noon. We do need people to register so that we have enough lunch for everyone, but you can register by calling 844-HRH-BACK. That's our 800 number, directly to the Spine Center.
How wonderful.
Yeah.
844-HRH-BACK.
Correct.
All right. Easy to remember. But you need to register to attend.
Correct.
All right.
And that's mainly so we have enough food for everyone.
Sure. All right. And that
is there a cost to all, Amanda?
There's not a cost.
Okay.
No, it's free.
That's awesome. Mm-hmm. It's great to get this, not only to have a specialized spine center, but then also to have this available as well, this seminar.
Right.
It's a great thing.
And we are doing seminars every month in different communities. We've had a couple in Quincy. We are doing one in Hannibal. We're doing Shelbina, Bowling Green, that kind of thing, just to get some education out to the communities about spine health.
Great. And all that information will be on your website, too.
Mm-hmm. It is.
Mm-hmm. All right. Excellent. Well, it's good to know the Spine Center unveiled just here in this last month.
It did. June 2nd, was our first patient. So.
Gosh. All right. Well, it's good to know it is here. And again, you're kind of kicking it off with this informational seminar, July 8th. And again, to call to register, 844-HRH-BACK.
Correct.
Amanda, great information, and thank you very much.
You're welcome. Thank you, guys.
Thank you.
Mm-hmm.
Amanda Wassman with Hannibal Regional Healthcare System. And again, for more information, just contact the Spine Center. And that's going to do it for this edition of Healthy Dose. It's brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. For more information, go online, hrhonline.org.